The Liver Leaders Take 5 podcast invites you to take a few minutes to better understand the importance between your liver and your overall health. During each episode, different liver leaders throughout California take 5 questions to answer the most pressing issues impacting your liver today. Hosted by the Liver Coalition, my name is Scott Succo, the Executive Director, and you can always find us at livercoalition.org. Welcome to another episode of Liver Leaders Take 5. I'm excited to be talking with Richard So, who's the Executive Director of San Francisco Hep B Free Bay Area. Richard, welcome.
Thank you so much for the invitation. Happy to be here.
Yeah. Well, you've got a fascinating background. It's interesting. You've actually lived on one of my dreams, which was service in the Peace Corps.
Yeah, that's right. Was a rural health volunteer out there. You have to do it for 2 years. It was a great experience and actually has helped me plan activities and better understand what works.
Yeah. And that was after your master's degree in New York.
Right before.
Right before. And then you left then, and then how did you decide to get into your master's then?
I went to the Peace Corps to see if I kind of wanted to do international work, but then while I was in the Peace Corps, the Affordable Care Act passed, and so I wanted to make American healthcare better, and so I wanted to get a master's in public health, and that's how I started.
Excellent. And then so with so many things impacting our communities, why hepatitis B?
It was a natural fit. This was an issue that deeply affected and disproportionately impacted Asian and Pacific Islander immigrants. I mean, we're talking 1 in 12 Asian American immigrants as opposed to 1 in 1,000 Caucasian Americans and the general populace. And then combining that with the fact that we have all the solutions in a lot of ways for hepatitis B.
So with that kind of optimism, what's the obstacle?
The biggest is lack of awareness. Because Asian and Pacific Islanders make up only 6% of America, there hasn't been very much said or done about hepatitis B. You combine that with the fact that more than 90% of folks infected aren't going to have symptoms until it becomes liver cancer. And so unlike other diseases where patients are going to be very visibly sick, this is a long-term disease that doesn't show until the very end. And so you don't have the visibility that you see like other diseases.
And so a lot of people are thinking, well, I've heard Hep A and I've heard of hepatitis C and B. What's the difference?
Really simply, hepatitis A, we would say, is the most different. It's a short-term disease, and the hallmark is transmission through what's called fecal-oral transmission. And what that means is that some maybe food preparer doesn't wash their hand and somehow infects the food that someone else eats from that transmission from feces into someone ingesting that. Now, in America, it's happened in homeless encampments. It does happen sometimes in food vendors, especially street food, but it happens a lot more in other countries where there's a lot more street food vendors. And that disease affects you from usually somewhere between 1 week up to a month. There isn't like a curative drug, rather you just hydrate and get rest. So that's hepatitis A, and that doesn't really cause any long-term damage. For hepatitis B, the main source of transmission is mothers giving birth to children when they themselves don't know that they have the disease. There is a vaccine, so you can be protected, but there is no cure. And hepatitis C is the opposite. There is no vaccine, but there is a cure, transmitted again by blood and sex, and we saw a lot more of that from blood transfusions in the 80s and 90s.
That was excellent. Thank you. And if someone wanted to get tested or vaccinated, who would they talk to?
Both testing and vaccination can be done at your own doctor. Under most insurance, it would be covered for both the testing and vaccination, and that's the truth for hepatitis A, B, and C.
Excellent. And you and I have worked together on the multi-cancer early detection blood test. I'm getting that passed, some sort of legislation, so that we can start making that early detection blood test available to folks, deal not only with liver cancer, but screening in all cancers. Your work with that has been instrumental, and although the bill didn't get past this session, the act, hopefully it will be reintroduced the next session. We have a lot of leaders in California that have signed on to that. Any thoughts?
Well, if we could do some early testing and you catch it early, for whatever the cancer might be or the disease might be, we can prevent that, and that's what we're trying to do here. testing, at least in the San Francisco area. There are many clinics that have sliding scale fees, and then you can always call us if you look us up at SF Hep B Free and you hit our helpline. We can help anyone find access to screening, vaccination, and we'll do our best to find access to linkage to care as well.
Fantastic. So Richard, what's your next project that you're working on?
Yeah, probably the most exciting project is one that we're calling the Blueprint Project, and that is essentially a how-to, just like an easy how-to you would take to build your IKEA furniture, but so anything that can reduce the barriers to implement these improved standards of care across different health systems. And so we're really excited to kind of put that on the board and see if anything sticks.
What's the website again?
Yes, that's sfhepbfree.org. And then you can also call us. That's at 415-336-2629. It is a warm line, so you may have to leave a message, but someone will get back to you, and you can ask any question there. You can also follow us on Facebook. Just look up SF Hep B Free, and you'll find us there.
Wow, you're doing a fantastic job, and thank you for your leadership, not just in San Francisco, but throughout California. You're the right person for them and for us in the community. My name is Scott Succo with the Liver Coalition, chatting here with Richard So. It's been a pleasure. Listeners can find this episode and others of Liver Leaders Take 5 on our website, www.livercoalition.org.